the next chapter of vessels, I'll discuss with you vasculitis. Very, very important. 3 questions came from this one in the INICET and 2 questions came in the NEET PG. Kawasaki and Henoch Scholin Purpura. How to remember the name of vasculitis? Vasculitis means inflammation of vessels. Okay? Large vessels is GT. कैसे याद रहेगा? Large test, grand test, GT, grand test. Large vessel, grand test, large test. Okay? Giant cell arteritis and Takayasu arteritis. Medium, Praveen Kumar, PK, Pan, and Kawasaki. And small vessel is immune complex and post-immune. Immune complex is Henoch, Scholin, Purpura, and SLE. And post-immune are the 3 of them, which is the Anka. 3 of them, which is Anka. Anka में 3 diseases are there. Church-Strauss, vaginal granulomatosis, and microscopic polyangiitis. So first, let's remember the name again. एक याद करो. Close your eyes and listen to me. Large, grand test. Giant cell, Takayasu. Medium, Praveen Kumar sir. Okay. मतलब Pan, Kawasaki. Small vessel में immune complex, without immune complex. Immune complex में SLE, HSP. And without immune complex में Anka. Church-Strauss, vaginals, and microscopic polyangiitis. Bas. Now, among these, very, very important is Kawasaki. Kawasaki is a fever of 5 days with cream-like findings. कैसे रहेगा? Kawasaki बाइक चलाओ तो चेहरे पे क्रीम लगाओ, नहीं तो सनबर्न हो जाएगा. Kawasaki बाइक चलाओ, चेहरे पे क्रीम लगाओ, नहीं तो सनबर्न हो जाएगा. तो Kawasaki क्रीम. C is conjunctivitis. R rash. E edema. A adenopathy. And M mucosal inflammation of tongue called as strawberry tongue. Mucosal inflammation of tongue called as strawberry tongue. It's called as strawberry tongue. ठीक है? Mucosal inflammation of tongue called as strawberry tongue. ठीक है? अच्छा. Now, other finding which can occur here is myocardial infarction and coronary artery aneurysm. 25% patients have coronary artery aneurysm. And one of a very, very important thing to tell you, the treatment for Kawasaki. Why it is asked? Because other vasculitis are treated by corticosteroids. But in Kawasaki, we give intravenous immunoglobulin plus high dose aspirin. Okay, IVIG plus aspirin is the main treatment for Kawasaki. And therefore, you must know this. You must know this. Okay. Next is Henoch Scholin Purpura. This was last year's NEET PG question. Most common vasculitis in children. I understand many textbooks say Kawasaki, but according to the textbook of Harrison and Nelson, the answer is Henoch Scholin Purpura. Okay, so Henoch Scholin Purpura, most common vasculitis in children. Clinically, 1 to 2 days after an episode of viral illness. That's how it starts. And this immune complex disease, the immune complex is antigen plus antibody. The deposition occurs in 4 areas. It is glomerulus, causing glomerulonephropathy, joints में arthritis, skin में palpable purpura, and mesenteric capillaries में there's colic abdominal pain. So 4 areas: glomerulus nephritis, which type? IgA nephropathy, joints में arthritis, in skin vessels palpable purpura, and mesenteric capillaries में it is abdominal pain. It's abdominal pain. Diagnosis के लिए take a biopsy from the purpura. Take a purpura biopsy, and this will show you a lot number of small capillaries, and the capillaries will have huge number of neutrophils, a topic called as leukocytoclastic vasculitis. मतलब neutrophils in the capillaries. But this finding is seen in all small vessel vasculitis. Is not a specific finding for HSP. So what is the specific finding for HSP? IgA deposition in vessels is a specific finding for Henoch Scholin Purpura. Okay, now comes the dreaded post-immune vasculitis. Post-immune. How to make this easy, sir? I'll give you a table which you must remember. See, all of these 3 show Anka, right? Now remember Anka, mnemonic is PCM. PCM matlab P Anka is seen in Church-Strauss and microscopic polyangiitis. Okay, Church-Strauss and microscopic polyangiitis. देखो अंका में PCM मतलब P अंका is seen in Church-Strauss and microscopic polyangiitis, मतलब P अंका and P अंका. Vaginous has C अंका. याद रहेगा PCM, सिंपल मोनिक, बाकी सब छोड़ दो. Kidney में all the three shows RPGN. All the three show RPGN. Okay. Now microscopic polyangiitis में this अंका and RPGN, nothing else. In vaginous, RPGN, C anka, but these patients have granuloma also. Granuloma, okay, granuloma. And along with that, they have a history of upper and lower respiratory tract infection. Sir, what are upper tract infection? URTI in case of vaginous. What are those? Those are, so यहाँ से otitis media, sinusitis, pharyngitis, and saddle nose deformity. This is an ICT question. Saddle nose deformity with septal perforation. That's a vaginous. मतलब upper respiratory tract infection and lower respiratory tract infection. Both of them occur in vaginous granulomatosis. And along with that, they have a very important necrotizing cavitation. मतलब it's due to a cavitary lesion in the lungs, and that can also show you infiltrates like pneumonic infiltrates in the lungs. It's not pneumonia actually, the infiltrates look like pneumonia, but they can also show you caseatic necrosis in the vaginous. Was this year's INICET question. Church-Strauss has a patient having RPGN, granuloma, and asthma, eosinophilia, and allergic rhinitis. Asthma, eosinophilia, and allergic rhinitis with sinusitis is Church-Strauss syndrome. So समझो बात को. If a patient has ANCA, granuloma, ANCA, RPGN, granuloma, asthma, Church-Strauss. If a patient has ANCA, RPGN, granuloma, upper and lower tract infection, vaginous. If patient only has RPGN, ANCA, nothing else, microscopic polyangiitis. That's it. Okay? So yes, it is called as EGPA, GPA. What is EGPA? Eosinophilic granulomatosis with polyangiitis. Eosinophilic granulomatosis with polyangiitis is vaginous granulomatosis. Okay? Chalo. Next we move to the topic of heart. And the first topic I take is vegetations. 4 diseases will show vegetations. That's rheumatic heart disease, non-bacterial thrombotic endocarditis, Libman-Sack endocarditis, and the infective endocarditis. Okay, so in the rheumatic heart disease, main etiology is group A, beta hemolytic streptococci. In NBT, what is NBT? NBT means non-bacterial thrombotic endocarditis. Non-bacterial, so no bacteria. Okay. So what is the cause? The cause is hypercoagulable states, which can occur in malnutrition and cancers. Cancer like SLAP, simple mnemonic SLAP. So it can also be asked other way. Which cancer shows thrombosis? SLAP. Stomach, lung, and adenocarcinoma of pancreas. Stomach, lung, and adenocarcinoma of pancreas. They are the SLAP tumor which shows NBTE. Libman-Sack is seen in SLE. Libman-Sack is seen in SLE, and infective endocarditis is seen in Staph aureus infection. Okay, so all the first three involves mitral valve, but infective mainly involves aortic valve. But yes, it also involves mitral valve. It also involves mitral valve, but mainly aortic valve. Okay, mainly aortic valve. Site. The first two have same site along the lines of closure of the valve. देखो, SLE is what? Immune complex. So what happens? Immune complex can go anywhere. So it can deposit on the valve or below the valve. On or below. So on both sides of the valve. Both sides of the valve. And in infective endocarditis, on the valve cusp. It's on the valve cusp. On the valve cusp. Types. Now, the first one is small, warty, and friable. Second one is medium. But important question that you should remember, that's a question asked, is Lucid test and shows no inflammation. The Lucid test, they show no inflammation. And the Libman-Sack is medium and is verrucous. Finger की तरह verrucous. Finger की तरह verrucous. Okay, like this finger verrucous. ये है warty. देख रहे हो ये wart है. देखो इधर ये wart है. ऐसे ये verrucous है. Clear? Okay. Now there is infective endocarditis. There is large bulky, friable, large, bulky, friable, and they are destructive to the walls and they are non-sterile. Matlab, they'll grow on the culture media. They'll grow on the culture media. So these are the four important vegetations. What else can we ask here? Listen to me carefully. Listen now, okay? Rheumatic heart disease treatment. Primary prophylaxis is benzyl penicillin. Secondary prophylaxis also is benzyl penicillin. Okay, it depends upon the rheumatic heart disease is rheumatic fever without carditis, with carditis, or with carditis and valve involvement. So those have different duration of treatment and those are very, very importantly frequently asked. Okay, in infective endocarditis, the criteria is the modified Duke's criteria, and for rheumatic heart disease it is modified Jones criteria. ठीक है? So you can remember this. That's all what you must remember. So what is sterilization? So if the vegetations will grow on culture media, it is non-sterile. But if it does not grow on culture media, it's sterile. So all of the first three are sterile, but only infective endocarditis is a non-sterile vegetations. ठीक है? We now move to the myocardial infarction morphological changes. Now, the basic idea is like a repair. In repair, we have read that the how does the cells actually deposit? So cells deposit in the heart or any tissue. It starts with blood clotting, then neutrophils, then what will come? Macrophages, then granulation tissue, and then collagen. And finally, there's remodification of collagen. Okay, neutrophils, macrophage, granulation tissue, collagen. The same sequence will also follow here. Same sequence. Plus remember, within 30 minutes, within 30 minutes, the heart shows reversible injury finding, and after 30 minutes, the heart shows irreversible injury findings. So, if the question is within 30 minutes, so these four findings are of reversible injury. If beyond 30 minutes, this one, okay, within 30 minutes, without beyond 30 minutes, it's actually of irreversible injury. Irreversible injury. How to remember the EM finding of reversible? I'm discussing general pathology also, cell injury topic also. Dekho, this normal cell, okay, but when the cell becomes injured, reversible injury, it shows Mickey Mouse image. मिक्की माउस इमेज, अरे क्या बना रहे हो सर? मिक्की माउस इमेज मींस सेल साइज इंक्रीज्ड, सेल साइज इंक्रीज. ये क्या है? ब्लेब्स. व्हाट आर दीज? ऑर्गेनेल स्वेलिंग. ओके, लॉस ऑफ माइक्रोबिलाई, लॉस ऑफ माइक्रोबिलाई एंड pycnosis. So if you get these finding, it becomes reversible injury finding. Mickey Mouse yaad rakhna, Mickey Mouse. Okay, loss of microbilli, bleb formation, organelle swelling, and pycnosis. Okay, in the irreversible injury, there is myelin figures and there's large flocculent amorphous densities. Okay, now on day 1, what cell comes? Neutrophils. 1 to 3, more neutrophils. 3 to 7, macrophage. 7 to 14, granulation tissue. And after 14, collagen. How to remember? मत याद करो, कॉन्सेप्ट यहां है. दिस अ कॉन्सेप्ट. न्यूट्रोफिल्स, मैक्रोफेज, granulation tissue, collagen. बोलो everyone with me. Neutrophils, macrophages, granulation tissue, collagen. So on day 1, neutrophils appear. On day 3, max neutrophils. Day 3 to 7, macrophages. 7 to 14, granulation tissue. Post 14, collagen. बस simple. Neutrophils, macrophage, granulation tissue, collagen. That's it. Okay, now before I move to the next chapter, let me take some doubts from you. This end of chapter of heart. Let's now take some doubts here. Complement deposition, RBI governor, PDF, okay, IVIG. Sir, please stay till midnight. We won't go everywhere. I am very hopeful you won't go anywhere, okay? Yes, HSP can also has increased risk of interception. Okay? अरे वॉरबर्ग इफेक्ट, हाँ जी, वॉरबर्ग इफेक्ट बड़ा क्वेश्चन पूछा रहा है, इसको मैं बता ही देता हूँ यार, आई एम वेरी सॉरी फॉर मिक्सिंग दिस वॉरबर्ग इफेक्ट। व्हाट हैपेंस इन वॉरबर्ग इफेक्ट इज एनी ट्यूमर सेल, ये ट्यूमर सेल है, ग्लूकोज विल एंटर अ ट्यूमर सेल in presence or absence of oxygen will make lactic acid. Lactic acid will combine with glutamine, and this entry of glutamine will now make it three things: lipids plus amino acids plus nucleotides. And these three things will make more and more tumor cells. That's Warburg effect. So this is occurring even in presence of oxygen, and hence we call this glucose hunger, और बिकॉज ऑक्सीजन प्रेजेंस है सो एरोबिक ग्लाइकोलाइसिस, एरोबिक ग्लाइकोलाइसिस। ओके, नेक्स्ट सर, अरे हाँ, ऑसम क्लास सर, थैंक यू सर, वेरी वेरी मच, थैंक यू सृष्टि, सम्यक, ऑसम मेडिको, nemesis. What is reperfusion injury? So when you give the blood back to the area of infarction, that area of infarction has more free radical entry, and the free radical entry causes more injury to the heart, and the calcium entry will contract the normal surrounding myocardium and hence will injure the heart very more, hence that's called reperfusion injury. So list of casetic and non-casetic melanoma, बेटा देखो casetic में there's only 4 examples, लिख लो, it is TB, it is syphilis, histoplasma, and coccidioidomycosis. All others are non-caseating. Okay. Sir, explain the topic of clotting factor absence which does not cause bleeding. देखो बेटा प्रसाद, that अगर factor 12 deficiency है, so 12 deficiency is in intrinsic pathway. The same function can also be done by factor 7, and therefore 12 deficiency is nullified because the activation of factor 9 can be done by factor 7 also, and hence 12 does not cause bleeding. Sir, NK sir, I have explained to you. Please see that there. Pedigree के लिए I have also made a separate video. If you type my name and pedigree, you'll get that video. Please watch that. Sir, प्रोफिलैक्सिस कब देते हैं आरएचडी में? डिपेंड करता है, अगर प्राइमरी प्रोफिलैक्सिस देते हैं विद इन 9 डेज ऑफ द ऑनसेट ऑफ फेरेंजाइटिस, विद इन 9 डेज प्राइमरी, ओके, प्राइमरी, ओके। सर डीआईसी जो है वो एक सेपरेट टॉपिक ऑल टुगेदर है, एंड आई आल्सो मेड अ वीडियो ऑन दैट, आई शेयर दैट, ओके। RGW, difference between IDA and thalassemia major. In both of them, RGW is increased. We differentiate these two by HPLC for thalassemia and serum iron studies for iron deficiency anemia. The differentiation of mild IDA versus thalassemia trait is done by Menzer's index. Okay. Sir, how pycnosis is reversible? Because pycnosis occurs because of chromatin condensation, because low pH. When the pH comes to normal, the DNA will again become normalized. Benzyl penicillin, how much doses, sir? And the timing. So देखो timing के लिए you have to know that 3 main conditions: without carotid, with carotid, and without carotid, with carotid, and carotid with the valve involvement. So 5 years, 10 years, and 10 years. 5, 10, 10. Okay. 18 years of age, 18 years of age, and 40 years of age, or lifelong. Certain के लिए एक जस्ट वीडियो डाला है मैंने yesterday in this, you can just see that blood transfusion updates में the last में blood transfusion है in this one, last में blood transfusion again is there. GVSD I have told you, net. So net I'll try to explain you separately at the last if time permits. Sir, any other cause for Libman's sac endocarditis? Usually not. It's usually SLE or any other cause of immune complex type 3 hypersensitivity reaction. Okay. RSG, Professor, I told you, sir, both factor 12 and 7 deficiency together cause bleeding. 7 alone will cause bleeding, sir. क्या कह रहा है बच्चा? हाँ, 7 only will cause deficiency from the extrinsic pathway. Okay. List and Fox. So देखो, list deficiency is called as the list deficiency often causes the defective phagolysosome, and it's called as celiac cashew syndrome. And Fox deficiency causes chronic granulomatous disease. Okay. सेल एजिंग का मैंने जस्ट वीडियो डाला है, प्लीज को देख लेना आज। ओके। हाँ, शुरू करें। देखो बीन ना मुझे एकदम बिल्कुल अपने रास्ते में रखता है। TH1 TH2 cells, sir, please. Okay, let's continue. Genetics will you revise today? यस, सब कुछ रिवाइज करेंगे, आगे बढ़ते हैं। ओके, नेक्स्ट टॉपिक, रेस्पिरेटरी सिस्टम। ओके, वन थिंग प्लीज, ओके, लास्ट में आई आल्सो डिस्कस ब्लड ट्रांसफर टॉपिक्स, सो प्लीज स्टे देयर। ओके, प्लीज यू कैन share this video with your friends so that they can also watch it, and if you like the video please put a like button, एक like button होता है thumbs up वाला, उस पर click कर दो, so that this will again come back to you when you want to revise it. Okay, that's a basic idea of putting like on this one. So I'm seeing that there's 1000 students now watching me live, and if you can just put a, एक बस क्लिक करना है, अगर वो कर दोगे, let's be very generous about it. Okay, चलो तो पानी पी के आगे बढ़ते हैं। रेस्पिरेटरी सिस्टम, फर्स्ट टॉपिक ARDS, हॉट टॉपिक, कहते हैं ना हॉटेस्ट टॉपिक ऑफ नीट पीजी। सो ARDS में दिस इज अ alloy. So in the alloy there is a type 1 and the type 2 pneumocytes normal side में, and here is the macrophage. Okay, so etiology will stimulate the macrophage, and macrophage will release IL-8, 1,6 and TNF alpha. So IL-8, 1,6 TNF alpha, they will actually activate neutrophils, and neutrophils will then enter the alloy. Here they release enzymes like leukotrienes, protease, and also PAF, and these enzymes will damage the type 1 cells. Because they will damage type 1 cells, the patient will have decreased gas exchange and hence will suffer from respiratory distress. Respiratory distress. Ultimately, because of the damage to endothelium cells by the neutrophils and type 1 cells, fluid will enter the interstitium, causing edema here, and also edema in the alveoli, and hence we call this non-cardiogenic pulmonary edema. Non-cardiogenic pulmonary edema. We call this non-cardiogenic pulmonary edema. Okay, चलो अब देखो, what is damage here is mainly which cell? Number one, damage to endothelium. Second, damage to type 1 pneumocytes. But type 2 pneumocyte is still intact. Because type 2 pneumocyte is still intact, therefore type 2 cells can then regenerate. The three stages of ARDS. First stage is what we are reading right now. It is called as exudative stage. Okay. Stage 2 is called as proliferative stage. Okay. Proliferative stage. And stage 3 is fibrotic stage. The proliferative stage is of which cell? Yes, this is of proliferation of type 2 cells. Why? Because type 2 cell is a type of stem cell of alveoli, and they can regenerate and redeposit the type 1 cells again. What other question can be asked? What is halin? Halin is fibrin plus damaged type 1 and type 2 cells. Fibrin is damaged type 1 and type 2 cells. Okay, fibrin is damaged type 1 and type 2 cells. Remember this. Okay. Now, having understood this, let's now move to the basic topic of, let's now move to the next topic of restrictive. Okay, before that, let's discuss obstructive pulmonary disease. देखो क्या होता है. If we take a ratio of FEV1 by FVC, normally the ratio is more than 0.7. ये normal होता है. If a patient has this less than 0.7, it is obstructive disease, obstructive. But if it is more than 0.7, it's restrictive lung disease, restrictive lung disease. ठीक है, obstructive and restrictive. Among the obstructive, there are 4 diseases: emphysema, asthma, chronic bronchitis, and bronchiectasis. Starting with emphysema. Emphysema is irreversible dilation and destruction of acinus. It can be centriacinar or can be panacinar. Centriacinar matlab proximal acinus involved. What is acinus, sir? Acinus is the airway distal to the terminal bronchiole. That's acinus. So if that is, say, proximal acinus, it's centriacinar. How to remember? See, smoke particle will reach the proximal part of acinus, and hence smoking will cause centriacinar emphysema. Whereas it mainly involves the apex of lung, and the acinus involved is proximal part of the, the basic acinus is the proximal part of acinus. In the pan-acinar, the main etiology is alpha 1 antitrypsin deficiency, because it's a systemic disease. Okay, it mainly involves the base of lung and it involves both proximal and distal acinas. How I used to remember this as pan से I remembered pan pizza और pizza क्या होता है base. So base of lung is involved in pan acinar emphysema. It is mainly due to alpha 1 antitrypsin deficiency. This deficiency they also cause in the liver. Please remember in the liver. So if this is a hepatocyte, there will be pass positive globules in the liver cells. This pass positive globules in the liver cells is what you see in the alpha 1 antitrypsin deficiency. The entire pathophysiology is referred to as protease anti-protease mechanism. Okay, protease anti-protease mechanism. Just to add a few things, emphysema shows pink puffers, barrel-shaped hyper-resonant lungs. Okay, next is asthma. Type 1 hypersensitivity reaction shows 3C. 3C matlab first C is Crayola bodies. Okay, Crayola bodies. First C, Crayola bodies, damaged respiratory cells. Second C, Charcot latent crystals due to eosinophil crushing. And third C is Kirschmann spirals. Kirschmann spirals, mucin plugs. So 3C is seen in asthma. Third is chronic bronchitis. So how do you define this? You see, define this as Mukesh. Mukesh, Mukesh कौन है? Mukesh in the PVR movie आपने देखा है? There's a person who keeps on coughing. In the first, when before the movie starts, have you remember Mukesh? So that is the person Mukesh. He keeps on coughing, and that is how you define bronchitis. He is a smoker who keeps on producing productive cough for 3 or more months in the last 2 consecutive years. Okay, cough for more than 3 months for more than 2 consecutive years. That is actually the basic uh, definition of chronic bronchitis. They have high read index of it is actually defined as mucin gland layer thickness by bronchial wall layer thickness. Okay, bronchial wall layer thickness, and more than zero point 0.4 is highly suggestive of chronic bronchitis. Later on, they can show you squamous metaplasia. Okay, squamous metaplasia. Okay, last one is bronchiectasis. Bronchiectasis. अच्छा, ये two bangles क्या है? What is two bangles? I don't know what is two bangles. That's very funny. Acha. Bronchiectasis is dilation and destruction of the bronchus, and it often involves the bilateral lower lobes. That's bronchiectasis. The main etiology here is chronic necrotizing infections. Okay, like it can be Staph aureus, TB, Aspergillus. It can be Gardner syndrome, cystic fibrosis, Young syndrome, autoimmune disease can happen, and foreign body. All of them are the basic etiologies of foreign bodies. All of them are the basic etiologies of bronchiectasis. Okay. Now we move to the restrictive lung disease. In this topic, I'll discuss with you pneumoconiosis. Very hot favorite. Often we'll see either 1 or 2 questions from this topic. ये पढ़ना ही है. Okay, it is अच्छा. So Mukesh is like Mukesh has 2 bangles because of disease, and Sunita is a new Mukesh. Okay, very funny. Great, yeah. चलो देखो, 3 of them, coal worker, silicosis and asbestosis. ठीक है, coal worker, that's anthracosis. ठीक है, mineral dusts, coal mines. Silica is of 2 types, amorphous and crystalline. Asbestos is also of 3 types, serpentine, crocodilite and amphibole. Remember, crystalline variety of silicosis and crocodilite of amphibole, they're more pathogenic. Among all the 3, the first 2 involves upper lobe and the last one involves lower lobe. Massive fibrosis is seen in all of these 3. Progressive massive fibrosis is seen in all these 3. Okay. Lung. In gross morphology, the coal worker does not show any finding apart from black pigmented lung. The black pigmented lung is called as anthracotic lung. Okay, anthracotic lung. Anthracotic lung. Next is silicosis. In silicosis, it shows eggshell calcification was this year's INICET question. Along with that, they show bilateral hilar lymphadenopathy. In the asbestosis, they involve pleural plaques, pleural effusions. In microscopy, the coal worker shows coal particles in the macrophage. You call this coal macules and coal nodules. In the silicosis, they show the silicotic nodules, the collagenous nodules. Okay, they are collagenous nodules. Okay, that's collagenous nodules. Okay, they are collagenous nodules here. And in the asbestosis, they show asbestos body and ferruginous body. What are these two? If there is a particle of asbestos with a coating of iron and glycoprotein, it is referred to as asbestos body. You can also call this ferruginous body if it is not asbestos, but it is something else. Okay. Next is the TB risk. The TB risk is increase in silicosis, and decreased T cell is the main cause for that. And increased lung carcinoma is the main finding of asbestosis, which is mainly causing adenocarcinoma lung more than malignant mesothelioma. Okay? So how to remember this and what are the question asked? Most common among these three is silicosis. Which of them involves lower lobe? Asbestosis. Which of them shows macules nodules? Coal worker. Which of them shows eggshell calcification? Silicosis. Asbestos body and ferruginous body are a finding of asbestosis. Okay? Now, which of them increase TB risk? Silicosis. Lung cancer risk? Asbestosis. Bus. Nothing else is required. Okay? Okay. Next is renal system. I'll just put a charger here. Our energy should not be less, but the laptop energy needs to be recharged. Okay. Chalo. Next is renal system. Now, in the renal system, we'll first talk about ground glass can be said to be in silicosis. Actually, if the topic is about pneumoconiosis, you can say the ground glass may be a feature of silicosis. Maybe, okay? But not exactly. It is mostly a feature of sarcoidosis like features, but often if among these three, the only answer it can go in is silicosis. Ferrous body and asbestos body, can you please tell me that? देखो क्या होता है ना, that if there is a asbestos particle, and around this particle, if there is a iron and glycoprotein rim, iron plus glycoprotein rim, it will be called as asbestos body. But if there is basically any other organic particle with a rim of iron glycoprotein, is referred to as ferruginous body. Okay, ferruginous body. Okay, I'll just take a few questions here. आईटीपी वर्सेस टीपी बता दो। हाँ, ये आईटीपी टीपी बहुत देर से पूछ रहा है। देखो आईटीपी क्या होता है? आईटीपी इज द डिस्ट्रक्शन ऑफ प्लेटेट्स बिकॉज ऑफ एंटीबॉडी अगेंस्ट GP1B9 and 2B3A. That's ITP. In TTP, what happened? Three things happen. Number one, there's thrombocytopenia. Second, there is MAHA, microangiopathic hemolytic anemia. And third thing is the neurological deficits. Okay, so if a patient has, suppose, seizures, or he has confusion or unconsciousness with a history of microangiopathic hemolytic anemia and thrombocytopenia, we can call this TTP. ITP only has thrombocytopenia, nothing else. Calretinin is basically a IHC. You can use it for the IHC. You can use it for the ये हर्शबर्ग डिजीज, बैग गासोसिस, बेसिनोसिस. देखो बैग गासोसिस इज अ शुगर केन डस्ट. ओके, द शुगर केन डस्ट कॉजेज हाइपर सेंसिटिविटी pneumonitis. मतलब इफ यू सी अ हिस्ट्री ऑफ ग्रैनुलोमा, समझो बात को, इफ यू सी अ हिस्ट्री ऑफ ग्रैनुलोमा with a organic dust, it becomes a hypersensitivity pneumonitis. Okay, sir, risk of cancer maximum which pneumoconiosis? It is the asbestosis. Pneumonia is not important from the pathology point of view. Okay, Coombs test may remember direct Coombs test is for the antibody on the RBCs, and indirect Coombs test is for the antibody free in the plasma. Other name connoisseurs, the name is only important. Just read the name of siderosis, stenosis. Those names are only important. Nothing more than that is required. Warburg बता चुका हूं मैं. Please just go back and see that. HUS. HUS में three things are seen. Number one, there is HUS, hemolytic uremic syndrome. So what you should see? Hemolytic मतलब महा, micro angiopathic hemolytic anemia. U मतलब uremia, renal failure, and there is thrombocytopenia. These three things is HUS. Pressure volume curve would be completely medicine topic. I don't think I should go there right now because I have to cover few other topics here also. Okay. Chalo. So let's move ahead. But those who are now again with me, please do not leave this, because very important chapter coming up is renal system, CNS tumors, not of mnemonics, and GIT. Hot favorite for NEET PG is GIT. And along with that, I'll then discuss liver and end with blood banking. So all of these are coming up only if you stay with me. Okay. So please do not leave this video in between. Ensure you watch it. पूरा रिविजन कर लो, तुरंत खत्म हो जाएगा, because the day will never come when you go back and watch the video again. ऐसा नहीं होता. It has never happened throughout the year. It may not happen again. So because only 40 days are remaining, please push yourself. There's a right time that you tell yourself कि I have to study maximum. If you tell yourself every day in and day out, every hour, when you just think of getting up off a table, you'll just sit down, because something will tell your head, let's study more. And once study yourself to study more, no one can stop you. The only thing who can stop you today is you. No one else can stop you. The only thing who can stop you right now is you. Once you have started for this entire thing, don't stop. You are all a marathon runner. You have been running this race for the last 5-6 years. This is the time you must sprint now. Stop running slow and run fast. Give maximum time. Increase your time. Come out of a comfort zone. Comfort zone क्या है? 10 hours, 8 hours, 6 hours a day. नहीं चलेगा. For the last few days, you have to put 10, 14, 16 hours a day. And this will help you to get a seat of your choice, putting the medical college or that branch you always wanted, you always deserved. So don't you deserve that? You deserve that. And for that, आपको कुछ extra करना पड़ेगा. And what is that extra? Extra is number of hours, nothing else. We all have same IQ. We all have been working hard throughout the year. We'll put just ahead of others is extra number of hours. Revision is the right key to that. Revise with me and do not leave this in between. Do not live in this in between. I'm telling you, something will be there. There's some hope is there, and we have to cling to the hope. And the hope is we'll do well. With whatever has happened previously, जो हो गया पहले छोड़ दो. We didn't score well in the last NEET PG. कोई फर्क नहीं पड़ता. My rank was 30,000 in INICET. कोई फर्क नहीं पड़ता. What matters is what is coming up now. And what is coming up now is 5th of March. And for that, I'll just ensure to study today well. Today, not tomorrow, today. अपने आप को बस ये promise करो that you will really ensure to give maximum time to studies. बाकी सब कुछ छोड़ दो. God is there. He will take care of us. ठीक है? And do not worry about anything else. Let's move forward. And next topic is casts. So casts actually are of mainly types. It is RBC cast, white blood cell cast, epithelial casts. Okay. It is granular cast, Highland cast, and broad casts. Let's see the main hallmark finding of RBC casts. It is glomerulonephritis. WBC casts, pyelonephritis, and tubulointerstitial nephritis. Okay. Epithelial cast in proximal tubule necrosis. Proximal tubule necrosis. Ischemia and toxins. Toxins like HgCl2, carbon tetrachloride, and ethylene glycol poisoning. Okay. Granular cast is seen in ATN and tubulo interstitial nephritis. Hyaline cast is the only cast which can be physiological. Remember this, very important question. Which cast can be physiological? It's hyaline cast which can be physiological. Okay. Broad cast is seen in chronic renal failure. Chronic renal failure. Okay. Next is how are the immune complex deposition? So I have taught you lot and lot number of nephrotic syndrome. Let's make a small diagram to conclude everything in a short diagram. Dekho. Suppose this is a glomerulus. Okay. In the glomerulus, there's a capillary. Okay. I'm writing C for capillary. Around the capillary, this blue one is GBM, and this one is a podocyte. So if you see a deposition below the podocyte here, below podocytes, it is called a subepithelial deposition. It is seen in PSGN, which shows humps, if you remember, and MGN, which shows spike and dome appearance. If you see an immune complex which is between the GBM and capillary, it's subendothelial deposition. It is seen in MPGN type 1, which shows tram track appearance and SLE. Intramembranous on membrane deposition is MPGN type 2, causes dense deposit disease. And on the mesangium is IgA nephropathy, and hence we call this mesangioproliferative glomerulonephritis. That is the simplest way to revise every of them nephritic and nephrotic syndrome. Just remember a few other things that RPGN, they show crescents. Okay, they show crescents. They show flea bitten kidney, and they show what? They show the rupture of GBM on the electron microscopy. RPGN is three types: RPGN type 1, 2, and 3. Type 1 is linear, type 2 is immune complex deposition, so granular, and type 3 is actually what? Type 3 is the pauci-immune, which we read already in the pauci-immune ANCA vasculitis pus. In diabetes nephropathy, very importantly, in the glomerulus, they show, first of all, most common diffuse GBM thickening, diffuse thickening of mesangium. So diffuse GBM, diffuse mesangium. But the most specific finding is Kimmel-Still-Wilson lesion called as nodular glomerulosclerosis. Okay, that's the most specific lesion. These nodules are actually composed of mesangium only, and hence they are called as intercapillary, because mesangium is between the two capillaries. So intercapillary glomerulosclerosis. It can be fibrin caps and can be capsular drops also. Next is the two varieties of RCC, clear cell and papillary cell carcinoma. The clear cell carcinoma is proximal tubules. Papillary cell carcinoma is distal tubules. कैसे किया? PCT, DCT. VHL, MET gene. VHL is on chromosome number 3P. Okay, 3P. And MET gene on chromosome number 7. Now, what is a microscopy? See, among these two, 80% of all the RCC clear cell carcinoma. 80%. Okay. This clear cell carcinoma, they show glycogen and lipids, and hence there is clear vacuoles. There is clear vacuole here. Clear vacuole. And in the papillary carcinoma, it shows the papilla like this. The papilla is referred to as chromophilic. Why? Because dark in color, we call it chromophilic pattern. So two varieties of RCC, clear cell and papillary. PCT, DCT, VHL, MET, clear cell and papilla. Papilla is dark here and has also called as chromophilic variety. We now move to the brain tumors. Most common overall CNS tumor is METs. Most common source of METs is lungs more than breast. Most common primary CNS tumor in adult is meningioma. In child is astrocytoma. Among the astrocytoma, the most common astrocytoma is grade 1, called as pilocytic astrocytoma. Okay. The most common primary malignant tumor in adult is glioblastoma multiforme, and children is medulloblastoma. What is MCQ asked? Meningioma. What does meningioma show? It shows NF2 mutation, and they show SAMO bodies. Okay, SAMOMA bodies. SAMOMA body. It shows SAMO bodies. Okay, the pilocytic shows Rosenthal fibers. Is grade 1, and so it has good prognosis. Whereas glioblastoma multiforme and medulloblastoma, they both are grade 4. The grade 4. Therefore, glioblastoma has very poor prognosis, and so has medulloblastoma. But the finding in medulloblastoma is it shows PNET, And PNET stands for primitive neuroectodermal tumor, and hence they show rosettes like this. Assay. It is referred to as Homer right rosettes. It shows this pink color center assay. It's called Homer right rosettes. Homer right rosettes. ठीक है, Homer right rosettes क्या कहते हैं बच्चे? Homer right rosette. It can be asked which are the other tumors which can show you Homer right rosettes. Remember, it can be seen in neuroblastoma, Ewing's sarcoma, pineoblastoma, okay, and surely melanoblastoma. All of them are actually type of primitive neuroectodermal tumor. Ectodermal tumor. ठीक है? We now move to the two main findings of NF1 and NF2. I'll first discuss with you NF2. So NF2 is due to chromosome number 22 Q deletion. Chromosome 22 Q deletion. A simple mnemonic NF2 is miss me. Miss me मतलब multiple inherited schwannoma, meningioma and ependymoma. Multiple inherited schwannoma, meningioma and ependymoma. Okay. Then is neurofibroma. Neurofibroma, it has CD4 cells, C34 cells. They show spindle-shaped tumor cells. Why it is called as neurofibroma? Because fibroma का मतलब होता है collagen, and they show collagenous tissue with mast cells. So if you see collagen, spindle cells, mast cells, and CD34 cells, it's referred to as neurofibroma. Neurofibroma, okay? A simple mnemonic is no space. ये क्या था? Miss me. और ये क्या है? No space. Now, no space मतलब N is neurofibroma, O is optic nerve glioma, S is sphenoid dysplasia, P is plexiform neurofibroma, A is active freckling, C is cafe allow spots, and E is eye lesion in iris called as Lish nodules. Eye lesions in iris referred to as Lish nodules. Now, some things are very important here. Like in the schwannoma, the microscopy shows some area having very huge number of cells. Okay, some area having huge number of cells, and in the area having huge number of cells, this is area of cells area, the cell will be arranged like a palisade assay. The area having huge number of cells is referred to as Antony A. Okay, so this area is Antony A. This less cell is called as Antony B. And look at the arrangement like this. This is called as Vero K body. Very, very important topic. Schwannoma. Very, very important. Schwannoma. Okay. Very, very important is schwannoma. So schwannoma में there is Antony A more cell, Antony B less cell, and arrangement is referred to as Verroque bodies. Verroque bodies. ठीक है? Verroque bodies. Okay. Some questions are asked here like rosette के ऊपर. तो देखो true rosettes. Rosette. If it says empty lumen, it's true rosette. Okay. And true is seen in Flexner Wintersteiner rosette. Okay. Flexner Wintersteiner. It is seen in retinoblastoma. Okay. And it's also seen in ependymoma. Ependymoma. Whereas pseudorosette is seen in the Homer right pseudosettes. Okay. Homer right pseudosettes. Yes. Next is the gastrointestinal system. In this, we'll discuss first of all achalasia cardia with Hirschsprung disease difference. Both of these come under the topic of agangliosis. Both of them means absence of ganglions. What happens in Hirschsprung is there's a loss of RET, red gene. Red gene helps in the progression or descent of the neural crest cells. Therefore, because these cells are absent, the distal intestine do not have ganglions, and so this hypertrophy of nerve trunks. Matlab absence of ganglions, hypertrophy of nerve trunks. Because of absence of ganglions, the calretinin is negative. Okay, calretinin, it's IHC, is negative. However, because of the hypertrophic nerve trunks, there is acetylcholinesterase positive. If it involves oil rectum, it is short segment and asymptomatic. But if it involves rectum, sigmoid colon, proximal colon, it's a long segment, and hence there is symptom like abdominal distension, there is abdominal obstruction, and there can be pain abdomen also. But that happens only in the long segment Hirschsprung. The screening test is called as anorectal manometry. That's it. In achalasia, there's a triad. The triad is of absence of ganglions. Because of absence of ganglions, there is a peristalsis causing mainly dysphagia in the liquid foods more than the solid foods. Liquid more than solid foods. Okay. In the lower esophageal sphincter, there is loss of inhibitory neurons, and therefore the LES fails to relax. And very importantly, the vagal supply is intact. So ultimately, what happens in achalasia cardia is there is a typical bird beak appearance in case of the barium swallow. The lower esophageal appears like this. The LES appears like this. This is the dilated esophagus, okay, and this is the constricted LES. Constricted LES. This appearance is called as bird beak, especially seen in the barium swallow. In the barium swallow it is seen. Okay, in the barium swallow it is seen. Next is very importantly celiac disease. Now this is a hypersensitivity to gluten containing foods. Which food have gluten? It is bro. Bro matlab barley, rye, oat and wheat. It is seen only in those patients who have a typical HLA DQ2, DQ8 and B8. Okay, DQ2, DQ8 and B8. It's seen only in those HLA which has a typical finding of HLA DQ2, DQ8 and B8. Others will not show this typical HLA. Remember this, okay? Only in those patients who have this typical HLA DQ2, DQ8 and B8, only those patients can show the celiac disease. The antibody you see here, this was asked also in last year's NEET PG, anti-endomycin antibody, anti-tissue transglutaminase antibody, and anti-gland antibody. These three antibodies are seen, among which the most sensitive is TTG, most specific is endomycial. Okay, biopsy duodenum, they show loss of villi and crypt hyperplasia. Okay, there can be lymphocytes and there can be T cell also, but the treatment is only one: gluten free diet. So only one treatment, gluten free diet. That's it. If the finding is mild loss of mild celiac disease, it is called as tropical sprue. Mild, remember, mild loss of villi because of infection is referred to as tropical sprue. One more disease you must remember is Whipple's. अब Whipple's में क्या होता है? Due to Trophibrema whippeli. Okay, what you see here is swollen macrophages with pass positive diastase resistant bacilli in the lamina propria. It happens because of the infection by Trophibrema whippeli. Okay, it happens due to the infection by Trophibrema whippeli. One more thing we'll expect in celiac is dermatitis herpetiformis, because the anti-claudin antibody, this cross reacts with skin and hence they form dermatitis herpetiformis. Okay, but in this one disease, it's very importantly pass positive diastase resistant bacilli. Okay, next is about the liver. Now in the liver, first of all you must remember, this again was asked in last year's NEET PG, the chronic condition of liver. The chronic liver condition shows what is called as nutmeg liver. Okay, nutmeg liver क्या होता है? Suppose there's a type, it's zone 1 and zone 3. So I hope you remember that there's a pole triad and central vein, right? Now there's a sinusoid between them. Zone 1 is this one and zone 3 is this one, and blood flows from zone 1 to zone 3. Suppose a patient has a condition here. यहाँ पर condition है. So if a patient has condition, so blood will not flow here. If blood will not flow here, so all sinusoids here will have more amount of blood. It's congested here like this. Whole condition is there. But ultimately, if the blood is not flowing, so all the liver cells around it will get necrosed also. All the liver cells will get necrosed. So what you say is centrilobular liver necrosis and sinusoidal dilatation. The entire area will appear red, while the area around pole triad will appear white or pale. The area around the central vein will appear red, and area around pole triad will appear white. This alternate color is called as nutmeg liver. meg liver. Okay, the acute condition, it shows hydropic change in the centrilobular area. Okay, in the centrilobular area. Now, in alcoholic liver disease, three things are seen. Stage 1, steatosis. Stage 2, steatohepatitis. And stage 3, steatofibrosis. ठीक है, three stages. Stage 1 में is only fat deposition. Small globules, microvesicular. Large globules, macrovesicular. Okay. Second stage is steatohepatitis. Very important, ध्यान से देखना. It shows cell swelling called as ballooning degeneration. Next is neutrophil infiltration. And third is inclusion body called as Mallory-Denk bodies. Mallory-Denk bodies. The typical mnemonic for this is weight in PHC. Weight in PHC is a mnemonic for Mallory-Denk body. This can be stained by cytokeratin 8 and 18. Was asked in last to last NEET PG question was this question. CK 8 and 18. So the mnemonic is weight in PHC मतलब Wilson, alcoholic liver disease, Indian childhood cirrhosis, alpha 1 antitrypsin deficiency, primary biliary cirrhosis, and hepatocellular carcinoma. Simple mnemonic for the Mallory-Denk bodies. Okay. In the microscopic stain of Masson trichromo stain, this finding shows chicken wire fence pattern. Okay, chicken wire fence pattern. Just remember one more thing, that here it can be compared to the non-alcoholic fatty liver disease. So ALD was an FLD. This could be differentiated by number 1, AST is to ALT ratio. 1:1 in this case and 3:1 here. And gamma globin transferase is very high in, is high in NAFLD, but is very high in alcoholic liver disease. These are two main differences of the liver function test of NAFLD and ALD. The treatment for ALD is obviously to cease and stop alcohol. NAFLD requires lifestyle modification. Lifestyle modification. Okay. Cirrhosis is not reversible. Okay, it can be partially reversible, but it's almost not reversible. It's partially reversible, you can say, not completely reversible. Next, we move to the liver tumors. Very importantly, we should discuss hepatocellular carcinoma with four main etiologies: ALD, NASH, and metabolic. PBC and PSC can also cause this, and increased estrogen exposure can also cause this. Okay? The main tumor marker is alpha fetoprotein, and the 2-IHC for this is very important. It is glypican, hepatocyte paraffin 1. Glypican and hepatocyte paraffin 1. A very important etiology we should differentiate from HCC is HCC with fibrolamellar variety. Why it is to differentiate about? Because HCC occurs in 6 to 7 years of age, but this variety in young age. Marker for this HCC is alpha fetoprotein, but this is alpha fetoprotein is normal. So what we use is a tumor marker called as neurotensin. Prognosis poor and good, and male involve more than female, and here male is equal to female in the fibrolamellar variety. So this is very important to understand. These two are very frequently asked. A fibrolamellar variety of HCC has male equal to female, young age, AFP is normal, and male is involved equal to female. Male is involved equal to female. Okay. Last chapter. Okay. Let's do not go outside. Okay. Last chapter. Blood banking. Tell me, how many of you have given blood anytime in life? How many of you have given blood anytime in the life? Well, we take 350 ml or 450 ml of blood. Okay. So from the 350 ml of blood, we often take it from those whose weight is less than 60 kg. But for anyone whose weight is more than 60 kg, we take 450 ml of blood. We take 450 ml of blood. Okay. Now, when you take the blood here, the bag, if you've given the blood, you'll remember the bag has some additives inside it. Those additives are called as blood bag additives. Blood bag additives. Okay. ACD, CPDA, SAGM, and CPDA. ACD is acid citrate dextrose. CPDA is citrate phosphate dextrose adenine. And sometimes we combine these two, SAGM with CPDA, where SAGM stands for saline, not sucrose, saline, adenine, glucose, and mannitol. Now, if you talk about the if you talk about the shelf life, shelf life of the ACD is 21 days, CPDA is 35 days, and SAGAM with CPDA is 42 days. So shelf life of what? Shelf life of RBC, PRBC, packed RBC. Okay, packed RBC. Yes, we can also call the CPDA 2 also, you can call that. Now, how do you store the blood products? The PRBC at 228 degrees Celsius, fresh frozen plasma at -20 to -40 degrees Celsius. Cryo is stored at -80 degrees Celsius. -80 is a better temperature. This is better one. Okay. And platelets is stored at room temperature in constant agitation. Platelet is of two types: random donor and single donor. How do you prepare single donor? We prepare single donor by apheresis. We prepare single donor by apheresis. Okay. Now use PRBC is for the correction of anemia. Fresh frozen plasma has all the coagulation factors, and hence we give it for DIC. Okay, DIC. However, in case of cryo has what? It has VWF, factor 8, and fibrinogen. So the main use of the cryo is VWD and hemophilia A. Hemophilia A. Even though you can give FFP also in hemophilia A, but the better thing to be given in hemophilia A is cryoprecipitate. Cryoprecipitate. Now, a very important question is that suppose you have been taken this blood from the blood bank. Okay, so how much long you should take to complete transfusion? So remember, transfusion completed within, in case of a PRBC, 4 hours, FFP, cryo, or platelets within 30 minutes of the issue from blood bank. From the issue of blood bank. Suppose you are in the ward and you have taken the blood and the patient has gone for suppose MRI, CT. Emergency may just return the bag back to the blood bank. Okay, do not waste time. Return the bag back to the blood bank. Do not store in the blood. So do not store the blood in the domestic refrigerator of your wards. Now that is a thing you have seen the wards, but that's not the right thing to do. It's the wrong thing to do. Okay. So if suppose the patient is not there in the bed, return the bag back to the blood bank and take it back when the patient comes back. Very, very important. Okay. Okay. Next is a very important question about massive blood transfusion. By definition, it is a blood amount given, equal amount of blood given in 24 hours or half the amount in 3 hours. Equal amount in 24 hours or half the amount in 3 hours. Matlab, suppose my body blood volume is 5 liters. So if I am given 5 liters in 24 hours, or I am given suppose 2.5 liters in 3 hours, it is actually massive blood transfusion. Okay, so if you get so amount of blood, you will not be able to bring the blood into right temperature, and so they will suffer from hypothermia. If the RBC goes so quickly, it can burst, and what can come out of the RBC is potassium, so hyperkalemia. The citrate in the blood can chelate the calcium and hence can lead to hypocalcemia. Ultimately, when so much amount of blood is going, see, nowadays we don't give whole blood, we give PRBC. So PRBC won't have factors, so the factors will get diluted. It's called dilutional coagulopathies, and ultimately citrate in the blood can be changed to bicarb by the liver, and hence they will lead to metabolic alkalosis. However, if the liver is not functioning well, in that case can lead to metabolic acidosis, otherwise will lead to metabolic alkalosis. Okay, metabolic alkalosis. Now, nowadays blood warmers are not recommended. Blood warmers are not recommended. Now, what are the other important things you should know? Other types of reactions. Well, the most common reaction is TRALI, transfusion associated, transfusion related, sorry, very sorry, Most common is FNHTR, febrile non-hemolytic transient reaction. FNHTR occurs because of the cytokine from the white blood cells, and therefore it is reduced by leukoreduction, and leukoreduction is done by filters. It's referred to as inline filters. Okay, it is due to cytokine from the white blood cells, and so it is to be reduced by leukoreduction by inline filters, or by inline filters. Second one is allergy. Okay, third, anaphylaxis. Fourth, reactions can also be hemolytic, which can be immediate or can be delayed. It can be transfusion transmitted infections, TTI. It can be TRALI versus TACO. So how to differentiate TRALI and TACO? TRALI is like antigen and antibody causing ARDS like symptoms. Often the antibody is anti-HLA antibody, and therefore such patients often suffer from fever. Okay, fever. They can have hypertension, sorry, fever, hypotension, and on the chest X-ray they show white lung because of AR DSI finding. However, in the TACO, which is transfusion associated circulatory overload, it often is due to a rapid transfusion in anemic patients, in anemia. So if you give blood fast, then there can be transfusion associated circulatory overload. This causes heart failure. It causes heart failure. Okay, it causes heart failure. So because they cause heart failure, it will lead to, first of all, increased blood pressure. It will lead to tachycardia, and very importantly, they'll have increased amount of NT pro BNP. NT pro BNP is high. Okay, pro BNP, that's very high in case of TACO. One more important thing is TRALI usually occurs within 4 hours to 6 hours. Okay, usually the TRALI is seen in fresh frozen plasma and within 4 hours is how you see the TRALI initiation. So if a patient has been given a fresh frozen plasma and the patient has fever, hypotension, it is TRALI. However, if the patient has been given PRBC, okay, PRBC, not FFP. If a patient has been given PRBC and the patient hemoglobin is low, the heart has failed and hence will lead to tachycardia and high blood pressure. That's called as TACO. The TACO and TRALI differentiation is very frequently asked, and do remember from the history also, if the history is of PRBC, do not mark TRALI, mark TACO. The patient may have tachycardia and high blood pressure. If a patient has hypotension and has been given FFP, then only mark TRALI. Few other things. Suppose a patient has received a 4 units of PRBC and 4 units of FFP, and there is only one line available. In that case, first you should give FFP, because FFP can be given within 30 minutes only, and then you give 4 units of PRBC. So patient was in shock. And he received 4 units of FFP and PRBC. What to be given first? First, to give FFP, let the patient's colloid be given to him, his blood pressure will rise, and then you give the PRBC slowly to them. Okay. Okay. Lastly, I think this is self-explanatory. There is keratin pearls in case of squamous cell carcinoma. The basal carcinoma in the skin, they show the nesting pattern, and the nest at the periphery will have this tumor cell like a palisade, because the palisading arrangement. This palisade is called as, is seen in basal carcinoma. Palisading is in basal carcinoma. Okay, they show nesting pattern, and at the periphery, the cells like a nest. This straight line is referred to as palisading pattern. Okay, palisading pattern. In melanoma, The main immunohistochemistry is HMB, sorry, HMB 45. HMB 45. Okay. Now, in thyroid, only three images can be asked. Number one, Hashimoto. So Hashimoto is actually autoimmune chronic thyroiditis. Okay, what is Hashimoto? It's a autoimmune chronic thyroiditis due to anti-TPO antibody. The main finding, the hallmark finding of Hashimoto is oncocytic or Hurthal cell change. If you get this finding, there's only one answer. That's Hashimoto thyroiditis. Very frequently asked, if there is Hashimoto, so what will happen to T3 and T4? There is increased, first of all, increased T3, T4 because of release from the gland. But later on, there will be hypothyroidism. So initially, because of gland destruction, T3T4 comes out, and then because they have complete destruction, T3T4 decreases and hence called as Hashimoto thyroiditis. Okay. Next, papillary carcinoma, follicular and thyroid medullary carcinoma. Starting with the papillary carcinoma. In papillary carcinoma, you see what papilla? Ye papilla hai. Okay, papilla. Now the papillary cells. Look at the papillary cells here. They show clearing. Look at the white area. The nuclear clearing. The clearing of these tumor cells will look like the eyes of this girl. This girl's eye is called as orphan Annie. So because there is no dark cell should be like this, right? But it's not dark cell. Ultimately, it's not dark cell, it's white cell. The white cell looks like the girl's eyes. The girl eye doesn't have eyeballs. Because the girl doesn't have eyeballs, the girl name actually was, she's an English comic character. Her name was Little Orphan Annie, from which the tumor cell name was given Orphan Annie eye nuclei. Orphan Annie eye nuclei. Okay, that's how the name was given. So findings would be nuclear clearing, nuclear grouping. These two findings can be seen even on FNAC. So FNAC and biopsy, both of these are diagnostic. In a case of papillary carcinoma, they have BRAF mutation. Remember, these have BRAF mutation, and they have increased risk in case of radiation therapy. Increased risk in radiation therapy, and they have ultimately good prognosis. Okay, papillary carcinoma have good prognosis, BRAF mutation, and they have good prognosis. Okay. In the follicular carcinoma, look at these follicles. Okay, normally we also see follicles. So how will I prove that these follicles are invading capsule? We can prove the follicles are invading capsule only and only by biopsy. So unless you don't do biopsy, you cannot prove capsular invasion. The name is follicular carcinoma. Follicles are seen normally also. So how will say this follicle is of tumor or this follicle is of benign cell or a normal follicle? You can say this to be tumor only when the follicles are invading. Do you see invasion on FNAC? No, and hence follicular carcinoma is what is diagnosed only on biopsy. The spread is actually hematogenous spread. They have hematogenous spread, and the risk is seen in the long standing goiter. Okay, long standing goiter often transforms to what is called as follicular carcinoma. Last is thyroid medullary carcinoma. Thyroid medullary carcinoma. So if a patient has, suppose, a RET red gene seen in men 2A and 2B, they often have thyroid medullary carcinoma, and they arise from the parafollicular. Remember, they are parafollicular C cell thyroid, parafollicular C cells of thyroid. Because the C cell release calcitonin, so this amyloid actually is A cal deposition. Because the parafollicle cells, they release calcitonin, and so this A cal deposition. The moment you see amyloid deposition in a thyroid tissue, there's only one answer. It is medullary thyroid carcinoma, and this is a type of neuroendocrine tumor. It's a type of neuroendocrine tumor, and hence it will have positivity with xanthophysin, chromogranin, neuron specific enlace, and also CD56. All of them are also there in these tumors. Okay, so this is three things. Remember, in a papricarcinoma, you see papilla. In follicle, you see follicle invading capsule. And in thyroid, you see the amyloid. And with that, you see this A cal deposition. A cal deposition. ठीक है, this is all about the thyroid lesions. So क्या क्या पढ़ना है इसमें? Along with Hashimoto, read and revise these tumors also. ठीक है, so this is all about the basic revision of the course. One small request to you, after this class is done, do not put it right now because it's a live chat. I will not be able to see your comments. So after the session ends, please don't put your comments right now because I won't be able to see it after the session ends. Once the session ends, please come back and put your thoughts into how much did you like the session, and if at all, please share this also with your friends. Okay, it was a long session, around 2.5 hours I took, but I am very relieved and I'm very happy that I could finish this. I really wanted to do this all completely for you because right now I feel that if I can save your time, this entire revision, if you do it yourself, how much time will it take? 3 days. And I have done that in just 2.5 hours. So do ensure that you just revise these notes once again, if possible tonight or tomorrow. And then if you have read my notes there, I think that's one thing you must follow there also. Do not look here and there. It's a time that a lot of things are going on. But if you can just concentrate and just put your entire thought process less, if you just put it in the decrease amount of time, duration, and volume, and you can revise this again and again, I think that is what will give you a better rank. So basic idea right now is to decrease your most unwanted energy to requirement where you actually want it to be, and where you want it to be is studies. Okay, so focus on, make a good timetable, stick to it, and RP for grand test. That's the only thing you'll do right now. Okay, so if you have any doubts, interleukins आज नहीं यार. So I have tried to given a lot of energy in today's class. I kept you all motivated throughout it because right now what we all want from each other is motivation. Stay away from anyone who doesn't respect you right now. Only stay with those person who actually motivates you day in and day out. Okay? If any person is telling you that you cannot do it, he or she is not your friend. Save your energy for good things, and very good things will happen after the 5th of March. Just stay focused, study well. Please make a good timetable that suits you, and everything will be fine. Everything will be fine. Okay? Wishing you all the best. Take care. If you require anything else, do come back and let me know. I'm always there for you, for revising the stuffs for you, for revising it again and again, for motivating you, telling you how to plan a session today and above in the next 30 days, 40 days remaining. But for that, the one thing that's required is studies. If you don't do that well, everything else goes fine and vain. Okay, nothing will work. Motivation is always secondary. First thing is study. तो पहले पढ़ लो. First thing is study. The more you study, you can motivate yourself. Study for more than hours. You come back to me, ask me, sir, how I can do better. I can tell you. But if you say, sir, I cannot study, now I can do what? No one can help you. So don't worry, guys. Please, please, please let me know how I can help you. I'll surely be there with whether guiding sessions, motivations, image-based session, small revision series, long revision series, whatever is possible, we'll do it for you. And because pathology as such takes into account a lot of other subjects, surgery, medicine, pediatrics, so do revise pathology with other subjects also. Okay, right now I think we can take a goodbye right now. I wish you a very, very, very good night. If you do the session very carefully, revise these notes completely, I can tell you out of 20 questions, you can surely make 14 correct. And rest will depend upon how much you have read in depth upon these topics also. Okay. So how to go forward with pathology from here onwards? Very important questions. Number one, first of all, today, please revise this notes again. एक पलट लो इसको. Just flip on the pages again. Okay. Secondly, read other things from tomorrow. Don't just read pathology, read other things also tomorrow. And when you come back to revise pathology, this few 10, 20, I think 20 pages notes, this will really help you to revise the entire thing in just 2 to 3 hours. Ultimately, what we want, itna padho, read it multiple times and decrease it. And read this again and again and give the exam. All sessions like this will be happening in the days to come, but that's a separate thing going on. You have your own plan, stick to your own plan. Whatever plan you have made, please stick to that only. Okay, wishing you all the best, take care, and God bless you all. Okay, I haven't taken dinner right now. It's already 11 o'clock, and I will also take dinner. I'm very sure that many of you might also not have taken dinner because the class started at 8:30. So please go back, have dinner, take rest, and let me know. I just one last request. Once the session ends, please put your valuable thoughts and comments once the session is over below this video. Okay, the record lecture of this video will be uploaded in my own Telegram group, Telegram channel, sorry, my own YouTube channel also, so you can watch it there also, and as well as this video will also remain in this channel for a long duration of time. You can watch it from here also. Okay, take care, God bless you all, a very good night to all of you. Bye bye.